Hello, and welcome to your online lecture for care and prevention. The topic of today's online lecture is the sports medicine team, and I'm extremely excited to start our class with this topic as our first lecture because many of you sitting in this course right now aspire to go into the field of healthcare. And that field can encompass multiple individuals from many different facets of the healthcare industry. Today's focus, however, is going to be on the sports medicine team with the athlete as the sole patient and the athlete as the focus point for today. So our first stop is really looking at who the members are in the sports medicine team. And you guys can see on this screen the image here. And so at the center of this diagram is the athlete because the athlete is the focus of the sports medicine team. And I put the coach at the head or the top of this circle because this is the person who interacts the most with your student athlete on a day-to-day basis and probably has the most intimate relationship with your student athlete. So they're going to know them the best, most likely. Next on the list is the strength and conditioning coach, or as some people call them, the sports scientists. The role of the strength and conditioning coach is to take a healthy athlete and make them stronger and maintain them. But then in an unhealthy population, the role of that strength and conditioning coach will vary, right? They will work alongside an athletic trainer or a physical therapist to develop strength programs that would help the athlete progress through the injury rehabilitation process. So your strength and conditioning or sports scientist is a very integral part of the sports medicine team. One healthcare individual that I didn't really see as a part of the sports medicine team until I started working collegiate athletics was the chiropractor. And we'll talk a little bit more about what they do, but their role in the sports medicine team is truly to provide manual therapy to our student athletes, in particular in the way of manipulation and joint mobilization. So their expertise really centers around joint nutrition and joint treatment, all aimed at doing one thing, getting the patient back to a healthy starting point, right? Your medical staff, I've grouped this, could include a medical doctor, could include a doctor of osteopath, but then also within the medical staff, you have your department assistants, for example, your receptionists. So your medical staff is going to be all encompassing, but the two major healthcare practitioners that are grouped into that medical staff button are going to be the medical doctor or the doctor of osteopath, again, to be defined a little bit later in this lecture. On this kind of side of the graph, or the left-hand side of the graph, what we have are individuals who specialize in rehabilitation. So that first person is going to be the physical therapist. Certainly could be an occupational therapist, but occupational therapists are going to work mostly with elementary, middle school age children. So we'll stick to the physical therapist whose major role is to work with the athletic trainer to get that patient back to sport. And most often, both of these individuals specialize in rehabilitation. We've learned over time that the physical therapist is considered to be the rehabilitation expert. And so a lot of times the longer term rehabs, such as an ACL reconstruction or a meniscal repair, for example, we refer out to the physical therapist because they have the time to devote and to spend one-on-one time with that student athlete. Another integral healthcare practitioner, a part of the athlete's care or the sports medicine team, is the athletic trainer. Now, I'm going to try to be as unbiased as possible. I am an athletic trainer by trade, but your athletic trainers, like the coaches, are the individuals who are going to work with that athlete on a day-to-day basis. They're going to see that athlete on a day-to-day basis, and so they're going to have a more intimate relationship than any other member of the sports medicine team. So they play a major role in not only treating and evaluating the student athlete, but literally communicating with these other members of the sports medicine team. And then last but not least, I've kind of named this category others, not intentionally, not because they're not important, but because sometimes they're not always a part of the sports medicine team, depending on who you work for or where you work. So that's the nutritionist or the registered dietitian. And these individuals play a major role in those individuals who suffer from mental health issues, in particular, those with eating disorders or disordered eating. But what we also know is that there are certain sports that are, for lack of better words, prone to working with student athletes who suffer from wanting to lose weight rapidly or increase weight rapidly, right? Like you can think of your wrestling or your swimming as a result. So they play a major role in figuring out dietary plans that would help an athlete reach their goal in a more healthy manner. You have your sports psychologist and then your massage therapist who will work with the chiropractor a lot of times on that manual therapy component. So these are the members of the sports medicine team. Now let's talk about how we can become one of them. If you are in this class and you have a desire to be a coach, right? And typically coaches usually aspire to go collegiate coaching or high school coaching. So I put those two on this slide. But you certainly could work with middle-aged school kiddos, or you could work with youth. But if your desire is to be a collegiate coach, then most often collegiate coaches are required to have, at minimum, a bachelor's degree, but at the D1 level, they prefer a master's degree, and they prefer that to be in the field of kinesiology. Certainly, it could be health and human performance or applied health science or exercise physiology, but in the field of kinesiology, because when we think about kinesiology, the study of the body, the study of human movement, that means you understand the sport to which you are actually applying to. We know about collegiate coaches, however, is that they don't just make it to the top most often. They start out by coaching club sports. They might volunteer as an assistant. They may have done a few free internships to kind of earn their coaching stripes before they hit the big leagues, right? High school coaching is a little bit different than getting a job as a collegiate level coach because it doesn't really have any requirements, right? And the requirements are all over the place if you look at different coaching positions. The reality is you don't need a bachelor's level degree to coach at the high school level, which on a fundamental level is very scary because you'll have these individuals coaching young athletes who are most prone to injury. And so it becomes important for you all who want to graduate to at least get your bachelor's degree and to at least specialize in either strength and conditioning or sports science, right? So that you can help these students progress to the next level, which would be college. One thing that I recommend for coaching minors that I academically advise is to get a teaching credential. When you get a teaching credential, they hire you not as a coach, but as a teacher. And so then you're on a teacher salary with teacher's benefits, and you get a stipend to be a coach. And so you get paid more. So it's one good way to get paid. High school coaching is by teaching and then doing the high school coaching in the afternoon, evenings, and on the weekends. Our strength and conditioning and sports science specialists most often are going to be certified strength and conditioning coaches, so they'll have that CSCS. Certainly, I've seen strength and conditioning or sports scientists that have other types of strength and conditioning certifications. Example would be performance enhancement specialist or corrective exercise specialist. What we love about the conditioning and strength, the certified strength and conditioning coach certification is that it requires you every year to turn in what are called continuing education units, or those CEUs. And so what this means about this particular certification is it's making sure that those that are certified with this particular certification are keeping up to date on their education, right? And that's important when you think about evidence-based practice and evidence-based medicine, where these strength and conditioning coaches or sports scientists are using the evidence to make decisions about the strength training programs that they want to utilize with their particular sports. To become a strength and conditioning coach at the college level, the recommendation is that you at least have a bachelor's degree in kinesiology, but the ideal would be a master's degree in some sort of movement-related program. Last but not least, I want to say this to you all because a lot of times I hear students say, oh, the CSCS is like being a personal trainer, and it's really not. First of all, anybody who is certified as a certified strength and conditioning coach has to have a bachelor's level degree to take that certification. So right there, we are already setting our strength and conditioning coaches above a personal trainer. Now, personal trainers, I believe, are important. But the difference is that a personal trainer, to become a personal trainer, you don't need the degree. Personal trainers, however, I think working as a personal trainer builds your skill to develop programs. So I'm not discouraging it. I'm just saying that the certified strength and conditioning certification is a nationally recognized certification. Individuals taking that must have a bachelor's degree, and it really adds something to that resume when you're applying to that particular job. if you're sitting in this lecture and you're thinking, oh, I want to be a chiropractor, you're probably going to be what's called the DC, or a Doctor of Chiropractic Care. This requires 4 years of chiropractic school. So you can think you're going to go get a bachelor's, usually of science, in applied health science, right? And then you're going to do 4 years of chiropractic school in addition to that to become a doctor of chiropractic. One thing I'm learning about chiropractors as I work with them more, as they actually go through the Masters of Science in Athletic Training, is their roles are actually pretty similar to athletic trainers. So that DX is going to stand for diagnose, and that RX is going to stand for treatment. So they diagnose and they treat musculoskeletal injuries and dysfunctions. But the major difference between them and an athletic trainer is athletic trainers are not allowed within the state mandates to manipulate or to adjust any bony structure. They also perform manual therapy, but in addition to that, they can apply therapeutic modalities. And I'm assuming like many of you have had like electrical stimulation applied to your body before. That would be an example. And they can also do the therapeutic exercise component. It's just very rare that we see them doing that in the field. But I've met many chiropractors who have what is called the sports medicine specialty, which means they're doing these other things that aren't traditional to the field of chiropractic. So then we have a physician, and there are typically two different types of physicians that you can go to medical school to become. The first one is a medical doctor, which is probably the most traditional route, and that would be a medical doctor, an MD. The second route, which is less traditional but becoming more popular, is a doctor of osteopath, or the DO. Regardless of which path that you choose, you're still looking at about 4 years of medical school, and then in addition to that, some sort of residency, fellowship, and or specialization, which typically takes a year or two. So you're looking at about 6+ years of schooling. One of the cool things that we've seen shift in the sports medicine team is that orthopedic surgeons in particular are starting to cover the sidelines of games with athletic trainers. In other words, we'll have a team physician who's an orthopedic surgeon traveling to our games, covering games. And again, it's creating this kind of interdisciplinary approach to healthcare. The next healthcare profession that I'll talk about is a physician assistant. It is not physician's assistant, it is physician assistant. A physician assistant certified, or PA-C, goes to school for about 2 to 3 years. And that 2 to 3 years is going to vary. I've seen 27 months, I've seen 24 months. It really just depends on the actual program. So for those of you sitting in the room thinking that physician assistant is what you aspire to be, make sure you're looking at the program and the length of time you're actually going to be in that program. When you graduate and you pass your board exams, you will be a PA-C. So what are the roles of a physician assistant within the actual sports medicine team? We know that physician assistants are like what are the right hand man or woman of a physician, right? They pretty much end up running most of the clinical practice. So they are medical professionals who diagnose illness. They develop and manage treatment plans. They prescribe medications under the direction of the physician they work with, right? And they serve as most often will serve as the patient's principal healthcare provider. So examples would be when I go into an appointment, most often I interface with my physician assistant. It's very rare that I see my actual medical doctor. Actually, the only time that I see my medical doctor is if I have some sort of red flag illness and or injury. So you can see how a physician assistant is really going to be the face of a medical practice. They work alongside and in collaboration with a physician. In fact, most physicians that I've worked with say they couldn't survive without having a physician assistant who assists them in their clinical practice. And one of the things that I love about the physician assistant is that they can work in every specialty in healthcare. In fact, what we're starting to see is the development of like specialization, so they can specialize in certain things, but they certainly are capable of being trained to do the different things that a physician would need. They're very diverse in their skill set. Next is a physical therapist. A physical therapist, most of you, if you're aspiring to do that, will go on to get what's called a doctor of physical therapy, or a DPT. Most physical therapy programs that are at the doctorate level are going to be 3 years, a 3-year program. And the major role of a physical therapist in my mind is that they are rehabilitation experts. When I have a long-term patient who's coming to me for long-term rehab, I typically refer them out because I want them to be with the expert. That isn't to say that athletic trainers aren't capable of rehabbing. It's just that it would take a lot of time from the other student athletes that we need to work with. The other thing that I think sets a physical therapist apart from an athletic trainer is athletic trainers, we specialize in sports medicine injuries, whereas our physical therapists are generalists. They can treat a variety of pathologies, illnesses, injuries that affect the musculoskeletal system, but also the human body system. One of the things that I think is really neat to see over time is this development of a DPT / doctorate of occupational therapy. So you have this dual credentialed individual. We're going to talk about occupational therapist on the next slide. And so I'm going to go there first to talk about it. Doctor of Occupational Therapy or occupational therapist, DOT, also requires 3 years of going through an occupational therapy program. So I get a lot of questions a lot of times like, what's the difference between an occupational therapist and a physical therapist? Both go to school for 3 years. So you're not cutting down the amount of time you're actually in school. I think the biggest difference is in their roles. So yes, occupational therapists are also rehabilitation experts, but their major difference is they help people learn to get back to the day-to-day tasks. So examples would be the ability to open up a cabinet in their house, the ability to turn the key in their car, the ability to take something down from a shelf or pick something up. So those day-to-day activities of daily living tasks. And the other thing that we see a lot with occupational therapists is they work with kids. They work with kids to teach them finite movements. They work with kids to restore them back to 100%. And so there's a little bit of a difference between an occupational therapist and a physical therapist. And so those two distinct professions still pour into the sports medicine team, but in different ways. The nurse practitioner. I think there are some of you who may be thinking about going into nursing. The nurse practitioner, or the NP, has two different routes to get there. If you are getting your BSN, which all of you are not since you're in our kinesiology department, then you would do 4 years of a BSN and then 2 to 4 years for an NP program. But if you're not doing a BSN, then when you graduate from us with your degree in kinesiology, you would do a 2-year Master's of Science in Nursing degree. From there, you would then go on to do 2 to 4 more years to get the actual nurse practitioner license. And so what are the roles of a nurse practitioner? What we see with nurse practitioners is most often they take a lot, they choose a specialization. So they choose peds, geriatrics, women's health, primary care, PC, or mental health. And then once they choose that specialization, they pretty much do the same things as a physician assistant. The difference is this. The nurses learned through a nursing model, and the physician assistant learns through the medical or healthcare model. And so there's a bit of a difference there. The nursing model is more holistic. They're not worried about finding out the injury. They're worried about treating the whole person. The medical model, as you guys know, is worried about finding the injury, treating the injury or illness. So it's based on a treatment model. And so they're a little bit different in their training and how they interact with patients, but certainly both the physician assistant and the nurse practitioner contribute to healthcare in very similar ways and can do very similar things. Last but not least is the athletic trainer. The certified athletic trainer needs a bachelor's of science, and most often in kinesiology. If not in kinesiology, then you would need to, at some point in time, take the prerequisites for that particular program. But now all athletic trainers are required to do what's called a 2 years master's degree in athletic training to become a certified athletic trainer. You know, in terms of roles, I happen to believe that when we're talking sports medicine, we're not talking just medical model. They are the leaders of the sports medicine team for the same reason the coach is integral in the sports medicine umbrella. We communicate the most with the student athlete. We are a part of their day-to-day treatment and care, and we have direct access to that athlete on a daily basis. In terms of our responsibility, they're all encompassing, right? So we try to work on injury and illness prevention and wellness promotion. We examine our student athletes. We diagnose and assess them. We perform therapeutic rehabilitation. And then last, but certainly not least, and not something that's always talked about, is we also are integral in the healthcare administration piece. So we submit insurance claims, we interact often with the physical therapist or the medical doctor. We submit doctor's notes, etc. So we also have a strength in healthcare administration. Now, I've told you a lot about the medical team. I've told you a lot about what each member in the medical team does, what it takes to become one of them. But let's talk about salary, because what I'm starting to realize with our millennial / Gen Zers is that salary is a big part of choosing your career. Certainly shouldn't be the only thing on the list, right? You want to pour into people. You want to help people get better. You want to see them thrive. Those are also reasons that to go into a healthcare field. We're all helpers, right? But certainly one of the questions is how much do these people actually make? And so these are taken from the labor, the Bureau for Labor Statistics. I can talk. And so when we're thinking about athletic training, just think right here, the median salary. This isn't the lowest, this isn't the highest, it's somewhere in between, is about $47,500. A physician assistant, you can see, starts at about $100,000. Then your nurse practitioners, etc., start at about the same. So again, we're looking at job differentials and differentials in salary. You can certainly see that both of these are comparative in nature. What we can look at also is how are these professions expected to grow in terms of job outlook? In other words, when you graduate, don't you want to know if there's going to be jobs available? So we can see 31%. We got 26% growth over the next couple of years, and then about 19% growth. Next are occupational therapists and physical therapists. Again, a lot of times I get the questions like, what's the difference, Dr. Cosby? Number one, they're not required to get a doctorate degree yet, but they will be soon. And so you'll see a little bit of a difference in the salary, and that's because that the occupational therapist isn't required to have a doctoral degree at the moment. We can see that physical therapy is growing much faster, but I can tell you guys right now that I think we're going to see a surge in the number of jobs available for occupational therapists. We have a lot more students interested in going into that field, so don't be discouraged about this low percent of jobs available. Again, it's growing. It's a growing field. And then you have your physicians, right? Physicians are going to make 2 times more than physician assistant or a nurse practitioner, and they should, right? They're making the ultimate decision. But you can see ultimately the different levels of salary based on what you choose to do in terms of becoming a part of that sports medicine team. My job, you guys, I'm getting pumped here. My job in this course is to develop your clinical mind. And I'm a clinician. So when I teach you over these next few weeks, my goal in every lecture is to develop your clinical mind, to start to plant the seed with the ultimate goal of you becoming that healthcare professional that you are called to be when you leave Point Loma. So my job as this professor in this course is to develop your clinical mind and teach you about the evaluation and assessment of injuries that occur to the musculoskeletal to the musculoskeletal system. Now, I will say this will be very what's the right word? We won't go too far in depth, because the reality is that when you get to upper division courses, you have the elective option to take the evaluation of lower extremity and the evaluation of upper extremity. But my job is to prime the pump. My job is to plant the seed and at least get you thinking about the different signs and symptoms that might exist with the injuries that could occur to the musculoskeletal system. So we will take a dive into each joint within the body. And by the time we finish this course, I hope that I have started the development of your clinical mind. And it starts here with the physical exam process. Everything that I teach you in this course will always start with the physical exam process. We can look at that from a medical model, or we can look at that from an orthopedic model. I think for the majority of this class, we'll live in this orange region where we're looking at what history questions should we be asking? What things should we be looking for when they walk into our clinic, or when we're looking at that injured joint? Swelling, bruising. What should we be touching? Which anatomical structures should we be touching or palpating? And then what tests can we use to help us do what? differentially diagnose and determine the presence or absence of a condition, right? That's the ultimate goal for me, for you, throughout these next weeks together as we journey and we venture into developing your clinical mind. Thank you for listening to this online lecture.